Good evening and welcome to the 2023 AMA Research Challenge, How to Advance Health Equity Through Research education session. My name is Ricardo Correa. I am a Program Director for Endocrinology, Diabetes and Metabolism, and the Health Equity and Inclusive Initiative Director for the Institute of Endocrinology at the Cleveland Clinic. And I will be serving as your moderator today. Can you display the code of conduct slide, please? Thank you. As our session gets started, I want to remind everyone of our commitment to be courteous, respectful, and collegial in the conduct of the AMA events. This event is governed by the AMA Code of Conduct, and claims of harassment and conflict of interest are taken seriously. Violation of the Code of Conduct may be reported confidentially via phone or web to our partner, Lighthouse Services, and you can see all the details of them in this slide. Thank you for your attention on ensuring that this is a safe, welcoming, and a professional meeting. Before we get underway with the forum, I would like to provide a general orientation to our event platform. To ask a question, please use the Q&A feature or raise your hand. You can find both features in your toolbar. We solicit some questions from participants in advance of this forum, but we want this event to be interactive, so please submit your question using the Q&A or raise your hand feature. Now, it's a pleasure for me to introduce our esteemed panelists today. Dr. Tracy Henry. She's an associate professor of medicine at Emory University School of Medicine, a clinical educator and an attending physician in both inpatient and outpatient medicine. She's the co-director of the Health Equity Advocacy Policy Track for Emory GME programs. Dr. Henry teaching and research include healthcare advocacy and policy, integrating behavioral healthcare into primary care, quality improvement and patient safety, and climate change and health equity. It's a real pleasure to have you here, Dr. Henry. And Dr. Luis Seja, who is a national clinical scholar at the Perelman School of Medicine and a fellow at the Children's Hospital of Philadelphia SHOP. Dr. Seja is a hospital-based internist and pediatrician interested in embedded anti-racism, advancing justice, and operationalizing equity within and across medicine. Thank you so much, Dr. Seja, for being here. And welcome. Our audience tonight include medical students, residents and fellows, and international medical graduates. And I am thrilled to have your expertise available to guide us through this important topic. Thank you for your time and your willingness to join us. To get started, can you walk us through your experience and how you have been able to successfully advance health equity in your research work? We can start with Dr. Henry and then Dr. Seja.
Thank you. Thank you, Dr. Correa. Very interesting enough, the research part of my career has actually evolved over time. And I've been involved in different types of research to advance health equity. And I would like to say that much of my work has been serendipitous. I'm being at the right place at the right time. And it's really having a passion around improving the health of the patients and the populations I serve. And the first time I really got involved in research, I was actually needing a summer job. And I actually came across this job for minimum wage to work in the lab, and it was Alzheimer's research. And I absolutely loved it. And that's when I really learned about the process of research, how to get involved. And most importantly, I learned at that time about patients that were disproportionately, affected by dementia. And so it really started to open my eyes about the issues of health equity. And then that's where I sort of began my career in advancing health equity through research. And then over time, I transitioned over to being a clinical research coordinator for an Alzheimer's study. And later I became a community health and research fellow. And that happened while I was a medical student. I actually spent a summer interviewing, conducting focus groups with historically marginalized individuals concerning barriers to seeking healthcare. That opened my eyes to the health needs assessments, how to go directly to the community to figure out what the needs are, what are their barriers to care? What's important to them? And so that was pretty helpful. And I learned all about conducting focus groups and conducting qualitative work. And then another summer, also while a medical student, I interned for the Agency for Healthcare Research and Quality. And I worked in the quality improvement patient safety department, and I had the awesome opportunity of learning all about health disparities. So I actually contributed to the 2008 Healthcare Quality and Disparities Reports. I was the one who was responsible for identifying the disparities in quality and access. I contributed to their state level snapshots and state level disparity analysis. And so that was a really exciting way of figuring out how I can advance health equity by identifying some of those barriers to healthcare and where we need to put some of our resources. And then over time, I also became a health policy fellow. I spent quite a bit of time doing fellowships all throughout my training. But that is how I was able to learn so much about different parts of research. I started off in bench research, and then later on as a health policy fellow, participating in what we call health services research. And at some point I did, later on, currently in my career, I'm doing med ed research and previously did QI. So I can, pretty much mentor, help any students, residents, fellows, because I've been involved in so many different types of research, but everything has been around and centered around advancing health equity. And so I'll probably pause there and turn things over to Dr. Seha.
Humble beginnings, Tracy. I did not know that, especially with your dementia work. That's awesome. I have a similar story. Well, I guess I'll start. I am a postdoctoral fellow at the with the National Clinician Scholars Program here at the University of Pennsylvania and the Children's Hospital of Philadelphia. My areas of focus and research really specifically focus on solid organ transplant ethics and policy, as well as looking at voting and policing as social determinants of health. Very med peds of me to be like all over the place, but I've settled on those three, and we are focusing on those three for the time being. I've also been involved with organized medicine in very many different capacities, which has, the policy aspect has come into all this other things. I've never been a bench research for bench type or had an affinity for bench research. I always thought it was kind of boring. As a med student, I was doing a lot of things for the sake of doing things in terms of the case reports. I'm going to do this chart review. I'm going to do that. I wanted to kind of buff up my CV. Really, I mean, that's what we were kind of told to do. That's what we thought we needed to do to get a good residency spot. It wasn't until my third year of medical school where you're in clerkships, and this is really where things this is where things kind of play out in real time, and you start noticing different patterns, wrongs, like why aren't we doing this? Why aren't we doing that? And for me, it was hepatitis C. So I went to Texas A&M for medical school, and we were in the meth triangle of Texas. And so we saw a lot of Hep C, mostly from IV drug use, things like that. And I somehow just stumbled upon a grant. I applied for a grant. I had $10,000, really. And I was like, what am I going to do with this? It was a very ambiguous type of grant, too. I was very surprised that I did it. And then I actually went to grand rounds with the GI department that talked about Hep C. And then I got this whole idea about implementing a comprehensive screening and treatment program for Hep C through our student-run free clinic. And that's where things kind of got started for me in terms of implementing interventions. How do we measure different outcomes? And for me, my research and what motivates me is this is the right thing to do. It's not until residency, and even right now on this health services research fellowship that I'm doing, where I'm starting to get more structure into it. And, one of the big things about research that I'm learning is what is your question? What kind of question are you trying to answer? All right. And how can I answer this question through a health equity lens? So that's what got me there. And then, of course, my thing that kind of reinforced all this, doing the right thing and looking at examining disparities and what can we do about them is that I trained in Mount Sinai, which is in New York City. My intern year was 2019 to 2020. So I had 8 months of non-COVID, and then the remainder of my training was all COVID. And we saw disparities and inequities play out in real times, and oftentimes they resulted in death. We saw a lot of Black and brown people of color die. And why were they dying? And so those are the questions that I wanted to answer as well. And so I had a lot of my work focused in advocacy in residency. And now I'm kind of pushing that more towards, health services research and implementing a lot of different things. And right now, when I say solid organ transplant ethics and policy, I'm looking at liver transplant specifically and alcohol-associated liver disease, because during the pandemic, people were alone, they were sad, and they were drinking a lot. And we admitted a lot of young people who were dying of alcohol-associated liver disease. And so that has been my big platform these days.
Oh, thank you to both of you for sharing your story. I think that when you tell your story about how do you get into health equity research, it's very interesting, and knowing personal story about my very similar, where I started basically I did my fellowship at NIH, and I was trying to do just hardcore research, and then going to practice, I saw that there was a lot of disparities in diabetes care between underrepresented minorities and the rest, and one of the times that I was trying to move in my career, I asked my mentor, and something always stick with me was that he told me, if you want to make changes in science, yes, you can continue doing research, but you have to want to have real impact in the community. You need to go to this pathway of healthcare, of health equity research and caring about that. So thank you for the work that both of you are doing. I know that Dr. Ceja mentioned about this, but I wanted to ask you about, have you seen any difference in the importance that people take when you talk about health equity research prior and post COVID?
I can take this one. So definitely, yes, there's a big difference. Health equity research has always kind of been around, but it was always just kind of like a niche kind of field for a lot of different people. It was always just people of color, researchers of color that were caring about these issues and writing about them, but not necessarily getting the money and, the fame and the glory, the visibility and the elevation of their research. It wasn't really until, one, we had COVID to thank for a lot of elevating the disparities and equities. But then we also had the murder of George Floyd as well that raised all these concerns. 2020 was, a year of racial reckoning for the United States at large. And there was a big shift in what we do about these inequities. In New York City, for example, what was happening at the beginning of the pandemic was that we were getting the numbers of everyone that was dying every day. But the Department of Health, the city of New York, was not releasing the demographic data. And so it wasn't until you had the communities academics really push to be like, you need to release the data. Because what we are seeing right now is anecdotally, personally, we are seeing Black, brown, everyone die of color. We are seeing that we are enrolling white patients more into these clinical trials than Black patients. All these different things that we were noticing, but we just needed hard data to do that. And it was the city that was kind of doing that. And then they finally released the data, and it was stark. It was really stark. And so COVID, George Floyd, Black Lives Matter, 2020 is really when we saw the shift. And we also saw a lot of different things come about as well. For example, Flexner report, and looking at workforce diversity, for example. Why are there less Black men enrolled in medical school right now than there were, 75 years ago, right? And what role did our institutions have to play? We really started asking the real tough questions. And so it wasn't just, the US, but I think medicine in particular had a real wake-up call when it came to that.
And I would just piggyback off of what Dr. Ceja was saying about the data piece. I found that very hard in the beginning of COVID. We're just trying to figure things out and asking for data. And so that's really one of sort of the barriers around health equity research, is just simply collecting the right geographic data. And what I mean by the right geographic data, there's also this issue of the misappropriate use of race in research. And so, what I like to think about for true health equity, and we need appropriate use of race in research, we need it to become customary. And before we can do that, we have to first acknowledge that it's racism and not race that leads to the downstream effects of health inequities. And so I think that's one of the barriers, a lot of things that I've seen. So even when we had some data, a lot of the data made race, pathologic. And so we have to really be careful around how we use race in research, but we definitely still need the data.
Yeah, and this also goes into the idea of what health equity research is and what it can actually look like, and what some of y'all's research might look like as well. So there, one of the big arguments against health equity data is that it's just a lot of reporting, right? There's this disparity, that's this disparity, but we need that foundation for us to frame and structure what kind of interventions we're going to do about that. I do believe that there is a lot of reporting, sometimes too much. You can find a disparity in almost anything that you want to. But we also have to start developing interventions. And so the next step beyond that is getting the funding to do those things and getting the community involved and getting everyone else involved. And then also just getting, people involved to care about this as much as we do. Because a lot of times when it comes to minority issues and minority matters, people don't care about it until it personally affects them. And so for me, it's what I've lived every single day. For COVID, for example, 17 members of my family were affected by it, right? My own mom was admitted to the ICU. It was very personal for me. And so how do we get to the bottom of it? But for others, I wasn't admitted. I isolated. I was in quarantine. And so it was very hands off to them. But for a lot of us that are involved with the work, it's very personal.
Yeah, and something that you mentioned, it's I think that's extremely important, because getting the data is getting the data, but translating that data into impact work to the community, that's the important part. So this go to the next question, and I want to remind everybody, please, if you have any question, just write it in the Q&A section or raise your hand so we can go to your question. But how do you engage and connect with populations in underrepresented communities in your work?
I think for me, over time, I always like to think about wherever I move, I try to get the lay of the land. I want to know a community needs mapping. I remember learning that in medical school. And where do you go? Where do you find these marginalized communities, and where are they located, and what are their needs? And so really you start by making those connections and maintaining and cultivating relationships over time. And you need to do that now. You don't wait till you need something and have a question and oh, I have a study now. Let me go meet these people and these leaders. You have to start now, wherever you are. You move to a new city, you're in med school, you're in residency, you're junior faculty. Learn about the place where you work. Meet the people in the community, meet the leaders, develop relationships. So you have boards at work, clinical boards or hospital boards. Invite patients and their families on these boards so you hear directly from them what they want, what are their needs. And I always like to tell my learners is that just because you have some statistically significant result doesn't mean it's clinically significant to right? So you got it published, and it's this name brand journal, high impact journal, but it meant nothing to a patient. So ask them what is it they want, what do they need, and what do they want to see? And it really starts with developing and cultivating those relationships up front, not later after you've have your question that you think you want to answer.
Yeah. I always start with positionality statements, right? These reflective statements. Who am I? Why am I doing this work? And should I be doing this work is what I like to think about, especially when it comes to community-based participatory research. The second thing I remind myself of is that communities own communities, and we are just guests, all right? Who am I to come and say, I'm going to do this intervention, you better get on board? It's not about, it's all about working with the community and not using the community, if that makes a lot of sense. And then Dr. Henry's completely correct, is that a lot of community engagement, it takes a lot of work. It really does. It requires building a lot of relationships and building a lot of rapport, not just knowing your community, but so CBOs, community-based organizations, are huge. You have to build those partnerships, because sometimes, especially if you have an academic affiliation, the community in general might have a feeling, inclination towards the institution itself. There might be some historical harms that have not been righted. right? There might be stories that have been passed down from generation to generation about, I don't go here because of X, Y, or Z. So how do you, come over that? How do you, as a researcher, as an institution, not only gain their trust, but how do you become trustworthy? That's like kind of the first part too. And then another big thing I was going to comment on is we learned it here. It's like, what is stakeholder outreach versus community engagement? So stakeholder outreach it's the bare minimum. This is your needs assessment. I'm going to get a focus group. I'm going to learn about it. I'm going to jot down these things. But community engagement is exactly what Dr. Henry was saying. All right, we're going to put the community in the driver's seat to drive equity, right? We're going to get them a seat at the table. We're going to let them speak, because this research, this intervention, whatever it's going to be, affects them, not necessarily us, right? So how can we make it work for them?
Great to know. Thank you. And I think that something that one of the most difficult things is to get that community engagement. And whenever, like, I'm a person that have moved several times, and when you move to a new place, for example, I just moved to Cleveland last year. It had taken me probably a year to get that trust from the community that I'm trying to serve. So that's important. Something that Dr. Henry mentioned is that it's not the research that drives you to then go to the community. It should be the first thing, go to the community, and then you start creating research and things that will help the community. But if you go with a plan already, it's very difficult to get the engagement from the community. Have you, both of you, used community healthcare workers in your projects? And how has been your experience with community healthcare workers?
I've actually had a pretty good experience with community healthcare workers, because they're oftentimes kind of the liaisons and with leaders in the community. They're trusted. They see their engagement, and then so they're like, okay, well then it's okay for me to be engaged. And so I think they're a really awesome opportunity and a bridge between the community and then also the institution or the researchers. And so they have been pretty successful in my workings in the past.
So I haven't utilized them, directly in any of the things that I've been doing. But when I did, I rotated with the NYC Department of Health and their Center for Health Equity and Community Wellness. And one of the things that the Department of Health did is that they have regular reoccurring meetings, like weekly, with community health workers, a big old coalition. And that's how they maintain their contacts. And that's how the DOH is able to go out and table and be, a trusted source for a whole different things, whether it's, STI awareness or come get your COVID vaccine. It's not necessarily the DOH that's facilitating that. It is the community health workers. And from my experience too, the community health workers have no problem telling, the academic institution or the department, like, this is not your place, so let me help you communicate, right? And so they're able to translate a lot of things that we want to do into what the community can understand.
Thank you for sharing that. Another question is, thinking about your health equity research, can you highlight some tips that have led you to success in advancing health equity?
For me, I always think about, at this stage in my career, I want to do research. I want to answer questions at this point that inform policy, because also if you can inform policy, you can even have a greater grand effect, right? And more patients. So I actually think the tip is really taking what you're seeing clinically, which is why it's so awesome if you're a researcher and you're still involved, have some clinical time, right? So you have a pulse on what's going on in the clinical world, and meeting and speaking and seeing patients. So I take what I see every day, those inequities, and I ask, what can I do to make this better? What kind of research or processes that need to be in place? What resources does this patient population need? What policies need to be implemented so that I can improve the health and wellness of my patients? And so that's actually where I start. And the work that I've done outside of the initial, when I had that first job, or just looking for a job and end up loving sort of Alzheimer's research, I actually just ask questions and then I go from there. I got involved in behavioral health integration when I was a junior faculty at my home institution. I, conducted a lot of primary care data collection, and actually used some of that to move things forward and looking at some of the disparities and outcomes of our patients at my institution. So really, it was just what I saw every day. I thought we needed more resources, more help for our patients around mental health, because if there's no mental health, there's no physical health. And then even from a med ed research standpoint, in order to advance health equity, increasing diversity and making sure that all of our students can operate with cultural sensitivity and take care of all patients. I'm doing work around that and how do we evaluate students in that manner. And so these are all different types of research, but I took what I was seeing every day to make a difference to advance health equity, whether it's med ed research, whether it's QI, whether it's qualitative or research or quantitative. I've done a lot of secondary data analysis. So I've had so many questions that I just wanted to answer quickly. And, it takes some time to get IRB approval and primary care data collection. And so I actually utilized in some of my work secondary data analysis. And so I had access to different like Medicaid databases and ambulatory, and MEPS and different data with ARC. And so I used those to answer questions. And then those questions turned into papers where they're actually can use to advance policy. And so those are some of the ways and tips that I have advanced health equity.
I think for me, one of the biggest things is realizing that you don't choose the issues really choose you. This has always been my case. For example, I never Hep C. I was just like, oh, that's kind of weird. But then you just kind of get invested for it. And then I remember, when I was kind of graduating, we were able to get we identified 2 people that had, severe like hepatitis C viremia needed treatment. And we got all of that for free. Like all that I was like, oh my God, if it's not just one, it's just 2. And but even if it was just one, that made it all worth it for me. And I remember as I interviewed people for medical school, as I interviewed applicants for residency, and even, now it's very clear when you're not invested in the work as well. And so doing things for the sake of doing things, it's hard to really have meaningful work out of that, in my personal opinion. And then in terms of other ways that we could advance, health equity, something that I found is what is going to be your measurable outcome. We love a primary endpoint. We love a secondary endpoint. And so what are those going to be? Sometimes you have to be really creative with it. And it might not be necessarily your idea, but you have mentors, you have the resources to try to do that as well. And also realizing that advancing health equity doesn't mean that you have to have research that's published in the New England Journal of Medicine or the Lancet or anything like that. Sometimes advancing health equity is just doing the right thing, because again, medicine sometimes is very a thankless job, right? But I'm going to go out of my way and make sure that people are aware of this one patient right over here that needs to be evaluated for a transplant. Okay. And so a lot of the things that we do at the bedside every day are advancing health equity. And sometimes that might be the Kickstarter for you to develop your own question that you want to answer and gather the resources, get an IRB and do those types of things. But realizing that, advancing health equity comes in many different shapes and forms.
I want to ask you about the support of institutions. Sometimes I feel that many institutions want health equity as a checkbox and not really as part of what they have to do. Do you feel that, well, probably both of you would be biased because you're in institutions that really want to advance health equity, but what do you think about the support of your institutions on your work?
I think my institution is quite supportive. It is part of our mission, DEI, and being anti-racist, and including, even from our IRB process. We have in my department a research committee that is committed to advancing health equity, and where we've started work with the IRB to make sure that the whole misappropriate use of race in research, that we're making sure that that the IRB is screening the protocols that come in and make sure that they're not misappropriating the use of race. We have training, we have research sessions. We make sure that our researchers, we have initiatives around making sure our researchers have implicit bias recognition and management. And so I think we're doing all sort of the right things to make sure that the research that we're conducting is appropriate and anti-racist. I think it's not just a checkbox, but we're really ingraining into the culture what we need to do to advance health equity.
Yeah, I think, are we performative? Are we declarative? Those are the things you don't want to be. You want to be something that's very actionable. And when you have at an institution that claims that, integrates health equity and anti-racism into their core values, into their mission statements, it's really easy to use that when they're saying no, right? You can remind them that, hey, this is what we're doing and my work supports that mission and it advances it in many different ways, right? There's different things like the IRB is now, we're revamping the way that we do this. And it's really becoming fully integrated, especially at the large academic centers. And the other great thing too, is that there's a lot of outside organizations that are supporting the work too, not only of just like learners and trainees, but also faculty. For example, one of the things that I did in residency is that I got a $20,000 grant from the ABIM to like look at clinical documentation and how can we advance equity through the way that we document, right? And so would your institution can support that? But what I did is I had the institution actually write a letter of support and said that we'll match any sort of amount that you are awarded, right? And so those are the different ways that institutions can also support.
Jumping a little bit about from now that both of your faculties, how important is to have in your application for residency or fellowship work in health equity?
I can comment now that I'm at the stage of being on faculty. A part of our promotion packet and requirements for promotion or advancing from instructor to assistant to associate to full professor is that you must have some work in DEI and health equity. You must have worked something documented that you've been involved in advancing health equity. So I think that's really showing that's a huge commitment that everyone should be involved in this work. And it's not just about marginalized populations or racial ethnic minorities. It's about everyone. Health inequities, health disparities is a problem from everyone, and everyone should be involved in the solution. So I like the idea that it's part of our promotional packet.
For me, I'm not faculty quite yet. I'm still a postdoc, right? But it is one of those things where it's becoming integrated into curriculums, and it's becoming something that our people are very much aware of. And I think a lot of, white people in particular are becoming acutely aware of their whiteness, especially in these spaces. I was at Yale for a conference just last week, and I met up with one of my surgery friends. And he went to USC. He was in Sigma Chi, and his name is Brogan, right? He is as white as they come. But one of the things that he had like this big moment because his surgery department had him, of all people, do a lecture on being an ally, right? It was a requirement, like you're going to come to terms with this. And what does it mean to be an ally? Not only, in the LGBTQ sense, but how do you be a white ally? How do you uplift and support voices? And he said it was like a weird dinner, really, because he was really coming to terms with it. But those are the types of things that we need to be doing, right? Especially for amongst our white peers, because it not only affects us, it affects everyone, just like Dr. Henry was saying.
Mm-hmm.
Thank you.
And people are always concerned about it being performative and declarative. Yeah. But, eventually, how do you change hearts and minds? I think, you have to kind of build it in the culture. And I always think about like how Medicare desegregated hospitals, right? When the federal government held back money and funding to hospitals, did not treat Black and brown patients, and they held back money. And sometimes it takes that high level policy statement or to hold us accountable so that we eventually becomes culture and eventually change hearts and minds.
Great. Another question is, what opportunities and also barriers or challenges do you face around using health equity data for patient quality and experience?
Money. Getting people to fund research is always hard because if you want to do it right, it requires a lot of resources. It really does, especially if you're looking at community engagement. How do you incentivize people, right? You don't want to like bribe them. You do want to incentivize them, though, to participate so you can have good quality data. And then, especially if you're doing qualitative, oh my goodness, that requires a lot more because not only you're doing the interviews, that's time, but then you have to hire the transcriptionist to actually, transcribe it all. And then if you have like a mixed method study, oh, you're just looking at all this other stuff that's going into it as well. You have to have a lot of buy-in, and you have to have a lot of people that kind of believe in your purpose and the aims and the objectives of your research. And so often there's going to be a lot of money involved. And so how do you convince people that this is worth their time to invest in?
Yeah, I agree with Dr. Seha. And I think is always the biggest issue, not enough resources. And I always think about people who, if health equity is truly the goal and is truly an important factor in that institution, then they will contribute funds there. And there's so much funding for so many other topics. And you think about the NIH and what they fund, and even though they've sort of moved towards putting more funding towards health equity research, but I think it's a fraction of the money that goes everywhere else. And if you don't have health equity, again, you don't have much else. So you really have to center your work around health equity, and so funding is a huge issue.
Yeah, and then not only money, something that I've recently have been like thinking about is, do we have we say health equity a lot, but do we have an understanding of what that is? What is our definition that we're using, right? And so RWJ, the NIH, everyone has like a own different version of it. Of course, it's very similar in that. But when it comes to research, your research and your research team, what is y'all's own definition, of equity? And does it align with what, these outcomes that that you want to accomplish as well? And so having a common understanding of what health equity is, are you actually doing that? Or are you looking at health equality, right? There's all these kind of like different and nuanced types of things. But we do throw around health equity a lot, and I don't think a lot of people understand what it is.
Great. Both of you mentioned funding. So can you give some recommendation or places where if one of our audiences interest in doing this, where they can find some of this funding? So AVIM, I know, Luis, you mentioned this, Dr. Seha, you mentioned this. Any other places where they can go?
So, go ahead.
Oh yeah, I was gonna say my hepatitis C had like literally 10 different like funding mechanisms. And they were all specifically things for medical students. So one, always look at your local county medical society. I got $10,000 from the Bell County Medical Society. Who knew that they were loaded with money? But they are there and they want to help. There's money everywhere. You just got to look for it. You really do. You can look at your state medical society. And even if for the AMA, I believe they still have what they call the section involvement grant. And so I think it's in, hundreds or not thousands, but like looking at the hundreds. So that's money as well. Look at your specialty, AAP, just there's money out there and there's a whole bunch of different things. And oh my gosh, hold on, Dr. Henry, I'm going to find something really quick. This was helpful.
I think while he's finding that, I can also add state, local. There's state, local funders that only fund citizens or participants conducting research in that particular state. And so these are private funders. These are people who donate monies towards endowments, or they want to give back money in some kind of way. And so those are, a way to get, and you kind of have to just kind of Google funds of private foundations, but they also give out money for conducting health equity research.
Yeah, so I just put it in the chat. So the AAMC actually, within the last couple of years, they opened their Health Justice Center. and it's been a great resource. They conduct a lot of different, research related to med ed and have extended their research into a lot of different areas. But one of the most helpful things that I found on their website is this funding. They have an ongoing list of different funding opportunities, and sometimes they're very niche, like you're going to go into cardiology, whatever it's going to be. This is about environmental health justice, but they compile it all into one place for you, which I thought was very convenient and takes a lot of the work out for yourself.
Thank you for putting that in the chat. We have one question from Jenna. Can you talk a little bit about how community engagement will look like as a medical student?
I can speak briefly on that. So it's a couple approaches to community engagement. It could be something that a lot of schools have community learning, social medicine type courses where you go, they have already pre-established community partnerships. And so community engagement could be getting involved through the school first, through the established structural, but then you realize that I really like working with this community and this population. And you want to continue working on, because a lot of those are just time dependent. Students attend the required time, but you may actually like that involvement. And then you may notice in some of the problems, barriers, or speaking with them, you realize some of the issues that the community is having. And then that's where you're born your clinical question, right? That's where you learn the question comes to you, and then you continue on with figuring out, how can I answer this clinical question or this research question? And maybe that's through research. And that's one way to advance health equity, but that's also one way for you to, because most medical schools also have a requirement for research. And then you can take that clinical question or research hypothesis or question that you have, and then you find a mentor. Most schools have databases or you go to the website of people doing the research that you're interested in. And I think that's kind of what community engagement look like. It's one way of starting. If your school does not have pre-established partnerships, then I would just, learn about your community, start going to community-based organizations, look them up, see when they have meetings, and then, just avail yourself, become part of the community. And then that's another way of figuring out what's going on and then starting a lasting partnership.
Yeah, I definitely agree with everything you just said. If you have a student-run free clinic, try to participate. That is like one way to really learn your community. And there's a lot of QI interventions that can happen through your student-run free clinic. And for the most part, that's already an established entity. And patients that do attend there, they're pretty loyal as well. And they know what you're all about. And then the other one is the reality is, when it comes to community engagement and community-based participatory research, as a medical student, unless you're coming in with the PhD and all this other stuff, the methods, the research designs, it's gonna be very difficult to be, come in guns blazing and try to accomplish that. And so the best thing to do is ask your medical school, who are the faculty that are doing some of this research as well. And there's nothing wrong for hopping on a project at all and just learning about what's going on, what is community engagement, community-based participatory research as well.
Thank you. We are almost at the end of the meeting, but the last question that I have for both of you is, what is your final tips or recommendation for our audience regarding health equity research and the importance of it?
I think just starting with what you love and enjoy, getting out there in the communities, really talking to them, engaging with them. And sometimes it's a personal. I know for me, a lot of it had to do with sort of personal experiences that I had with the healthcare system, but also what I saw when I went out into the communities. So just starting there first, really learning what the issues are, what's important to the patients and the communities, and then you go from there. The next part is finding a mentor. And I'm pretty sure we've had some prior sessions on that as well. But at first, have your question, establish what your interests are, and your passion will really take you where you need to be. And then that will keep you going. That's how you're able to be successful in research and advance in health equity, because you care, you identified an issue, and then you run with that issue until you get the answer through research.
I know for me, as a medical student as well as a resident, one of the things that I always found very helpful is that within your EMR, whatever that's going to be, we used Epic. I always created a patient list. It was called Patients Past and Present. And every patient that I put on that list, they had some sort of significance, whether it was personal significance or it was an interesting case, or I have a sticky note and I would literally type out a paragraph on that sticky note. And I was like, this is why this case was so up, right? Like, this is why it made me upset. For example, my first rotation of residency was on the renal consult service. And the most striking thing about that rotation was how every single patient that was on that list was Black, right? And I was wondering why. And then you learn things about, EGFR and how we calculate it and how we correct for race. And that kind of led me on this whole journey. And then eventually testifying before the American Kidney Association, right, to change race correction and help, change it over at Sinai as well, to not do those types of things. So keeping like a little a patient log has always been helpful, because when you're looking at advancing these types of issues, people will hear objective data and this and that, but it's always going to be the stories, right? It's not what you say, it's how you make people feel. And that's how you really kind of get people behind what you're trying to do. So that's what I've always found extremely helpful. And then again, the mentorship, that is a huge key as well. And then getting involved. You don't necessarily, of course, you're here at an AMA talk. We would love to have you be a member. Right. And for medical students, there's a lot of reasons to it. I came up through organized medicine. My personal and professional development was also through organized medicine. I learned how to make an argument, and a pretty good one at that. So, and I encourage you, it doesn't have to be in organized medicine, but get involved. Truly, I think that's going to be the best way that you can find and learn and develop those skills.
Yeah. So thank you so much, Dr. Seja, Dr. Henry, for this amazing conversation. I think that your experience, your leadership in the area was transmitted to everybody. Really appreciated the time that you took today for this. So thank you to everybody for participating in tonight's educational session. The AMA is committed to providing medical students, resident fellows, and international medical graduate a best-in-class opportunity to build and showcase research and engage with the AMA beyond traditional policies and advocacy opportunities. Please be sure to visit the semifinals hall to cast your vote for the best research, which is an AMA member exclusive opportunity. The top 5 voted participants will advance to the finals, which will be held on February 4, 2024, for a chance of winning 10,000 grand prize sponsored by Laurel Road. With this, again, thank you so much, our panelists. We learned so many things from both of you. It was a real pleasure to be your moderator tonight, and good night. Thank you.
Thank you.
Thanks, everyone.
Good night.